Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. An abundance of research in recent years has shown that regular consumption of caffeinated coffee can help reduce the risk of age-related dementia, liver cancer, and non-alcohol-induced fatty liver problems, known as NASH, or non-alcoholic steatohepatitis. This is a fatty liver problem that's caused often by having too much sugar or carbs in your diet or too many fatty foods. But caffeine can help to mitigate the damage done by this sort of lifestyle behavior. Caffeine from coffee and tea also turns off the mTOR pathway in cells. This is an effect that's strongly linked to reducing the risk of several common cancers. And most recently, this has been shown to be true for stomach and colon cancer. Switching off the mTOR pathway, which caffeine can do, seems to be very helpful in preventing those cancers from developing. Caffeine is also an antioxidant and an immune system modulator. It's been shown to reduce the release of inflammatory chemicals called cytokines that we often see in different arthritic conditions. And through various signal pathways within the cells, caffeine is also shown to help kill emerging cancer cells and demonstrates other really impressive anti-cancer properties. So caffeine from coffee has some great benefits. As well, caffeine also switches on longevity genes in our cells, the SIRT2 gene specifically, which helps the body burn fat more efficiently, increases the production of new energy factories in our brain cells. The energy factories in your brain cells are called mitochondria. If you can produce new ones every so often, the brain cell works a lot better. Also, the SIRT2 gene helps inhibit the release of inflammatory cytokines that are associated with arthritis and cardiovascular disease. SIRT2 activity also increases insulin sensitivity, which helps to improve blood sugar regulation in the prevention and management of type 2 diabetes and metabolic syndrome. So when you're having caffeine, it's switching on the SIRT2 gene, and you're getting these indirect benefits as a result. SIRT2 activity from the consumption of caffeine is also shown to improve blood cholesterol and lipid levels, and thus it's linked to a reduced risk of cardiovascular disease. As well, increased SIRT2 activity increases DNA repair and lengthens telomeres at the ends of our DNA strands, which are effects associated with cancer prevention and anti-aging. So the consumption of caffeine, because it turns on the SIRT2 longevity genes, gives you these additional benefits. So there have been a lot of impressive studies in recent years showing the health benefits of regular caffeinated coffee consumption. But is caffeinated coffee safe to drink if you have high blood pressure, or hypertension as it's known? That's been the big question. We know that caffeine is also a stimulant, which means it can potentially elevate heart rate and increase blood pressure. Well, a large study published in the Journal of the American Heart Association in December of 2022 helped to answer that question. The study looked at data from over 18,000 subjects ages 40 to 75 years old living in Japan. 65% were women. Followed these individuals for 19 consecutive years. So it's a pretty long study involving a lot of people. After assessing blood pressure measurements over the course of these 19 years and looking at the subject's caffeine intake from coffee and green tea, they didn't look at black tea because in Japan people have green tea, not black tea. The researchers noted that greater coffee consumption, 2 to 3 cups per day, was associated with having double the risk of death for cardiovascular disease in subjects who had a blood pressure reading at or above 160 to 179 over 100 to 109. So in these people that have what's known as grade 2 high blood pressure or grade 2 hypertension, they had double the risk of cardiovascular disease if they had 2 to 3 cups of coffee a day compared to subjects with blood pressure in the same elevated range who did not drink coffee. Interestingly, no association between coffee consumption and cardiovascular disease deaths were observed in patients with normal or high normal blood pressure or in those with grade 1 high blood pressure or grade 1 hypertension. So what does that mean? Normal blood pressure is a reading of less than 130 over 85. High normal is 130 to 139 over 85 to 89. And then grade 1 high blood pressure or grade 1 hypertension is a reading of 140 to 159 over 90 to 99. People in blood pressure range encompassing normal, high normal, and grade 1 high blood pressure, even if they drank 2 to 3 cups of coffee a day, it didn't increase their risk of cardiovascular death. But as soon as blood pressure was above that range, in the grade 2 range, risk of death doubled. Of note is the fact that green tea consumption, although it contains caffeine was not associated with an increased risk of cardiovascular disease death in patients with normal blood pressure or any degree of high blood pressure, making it a safer choice for those who have high blood pressure. So people with high blood pressure, even if it's grade 2 high blood pressure or beyond, drinking green tea didn't seem to give them the doubling of cardiovascular disease deaths that we saw with people drinking coffee. Remember that green tea has another unique compound called the EGCG, the epigallocatechin gallate, a really unique polyphenol, which, like caffeine, also activates the sirtuin longevity genes and in turn results in increased fat burning, supports memory function, and provides a host of impressive anti-cancer properties, some of which have been proven recently in people with certain types of cancer or precancerous states. Just giving them EGCG extract from green tea produce these incredible effects. So some studies show that EGCG from green tea and green tea extract supplements can also improve blood sugar, cholesterol, and triglyceride levels, as I've commented on in previous lifestyle medicine updates. So for most people, 2 to 3 cups of caffeinated coffee per day can provide some very impressive health benefits, as can green tea and very likely black tea as well. Why do I say that? Because black tea is just a fermentation process of green tea. So black tea is really green tea that's undergone one additional fermentation step. So it still has caffeine in it and some other interesting antioxidants. But for those with high blood pressure, it appears that they should avoid caffeinated coffee and possibly use green tea as an alternative caffeinated beverage if they want to have something of that nature. Remember, of course, and as the researchers commented on in the Medscape interview, adding cream and sugar, not to mention whipped cream and chocolate, to these coffee and tea drinks very much detracts from their health benefits and is very likely to increase the risk of cardiovascular disease by raising blood cholesterol and blood sugar levels. So I've included the references and links for the American Heart Association journal study and the Medscape review article on this study in the text below. Thanks for watching, and I'll see you next time.